doing an educational piece here on breast implants. Implants are not a lifetime device. There's a rare association with breast cancer called ALCL. Really, that's with a textured implant. We don't use a lot of textured implants. I'll talk a little bit about that as we go forward. And the third main issue is that you could have illness related to your breast implants. This is quite rare, but it's important to understand those three main things. Not lifetime, rare breast cancer associated with a textured implant, and rare autoimmune disease or illness related to a breast implant. Have to understand that if we're going to accept using a breast implant. The patient decision checklist is mandated by the FDA that you go through and sign it and have all of your questions answered by myself and our practice. This is an educational piece to get you a head start in your consideration of a breast implant surgery. It's several pages, formatted the same and created for each implant manufacturer in the same format but with information specific to that manufacturer. The data includes data from core implant studies for that specific implant and includes data from both reconstructive and aesthetic surgery. And so the data is mixed and is hard to compare between the manufacturers and honestly can get confusing. I would not have necessarily laid it out exactly like this. And because of the confusion, we're doing this video to help kind of work through it bit by bit. Along this video, we've sent you a written copy of this for your review. Along with the patient decision checklist, we'll give you a copy of the manufacturer's pamphlet handout. It starts on the checklist by going through who's a candidate, what might be a contraindication for surgery, including an infection, having cancer or previous cancer, and pregnancy or nursing, and then conditions that may put you at higher risk, including medical conditions, being a smoker, medications or chemotherapy, having had radiation, and other factors. So the risks as they're categorized in the checklist honestly get a little bit hard to work through. The bottom line is it's an artificial device. We're placing it in the body and our tissues covering it. At some point in the future, there's likely going to be an issue. We need to go back and reoperate. It's really that simple from a beginning standpoint. With any surgery where there's an artificial device, we could have an infection or some other problem. With an implant, your body forms a capsule around the implant, and we can have problems with that capsule of being too tight or capsular contracture. That's another of the issues, probably one of the biggest, especially early on, in cause for reoperation. Additionally, the implant might not heal where we want. We might not get the shape we want. So a shape issue with the implant or malposition of the implant is another reason for reoperation, either with the healing over time or over time with the shape of the breast changing and being a reason for reoperation. So those are the biggest categories: implant related or breast change related or capsule related over time that I see for reoperation. That said, let me go through the specific risks that are listed in the checklist. We can see breast pain in a small percentage of patients. It's not uncommon that we'll see this temporarily. It's generally something that we can absolutely work through. Sensitivity change to the breast or nipple. Temporary change is very common. Long-term loss of sensation in the nipple is very uncommon. Shape asymmetry is something that we may see, and of course perfect symmetry is rare to see. Really, nobody is perfectly symmetric. Weight change may change the breast shape or size. Infection is possible, as I previously mentioned. We can see swelling or scarring. Fluid can collect around the implant. We call that seroma. It's something that if we notice a size change in the breast, it's definitely something you want to report, we want to check out. We can see bleeding around the implant. Generally, if we see that, it's around the time of surgery, and if so, that's something that we want to evaluate and consider reoperation. If we're doing a bigger operation, it tends to be a circumstance where it's a rare complication of having loss of tissue or loss of nipple tissue. Definitely not desired, but is a very small risk, and that's something that's pointed out to you at consultation if you're at risk of those complications. Lack of ability to breastfeed is a rare complication. That is typically with breast lift procedures, but it is a small possibility that we see an increased risk of that. There are other risks such as complications of anesthesia, chronic pain, bleeding, damage to surrounding tissue, or impacting breast imaging, which is expected because the implant itself causes changes in the imaging. We are still able to do effective breast imaging, and it is different, but it does impact breast imaging. I'm holding a textured implant, this fuzzy surface. This one happens to be shaped. I use a lot of round implants, and I even like round textured implants. Why? A textured implant can have the benefit of having more position stability in the breast, and there are circumstances where that has a benefit. That may be a benefit for you, and I'm more than happy to talk about using a Sientra textured implant should that be something that you have an interest in. A smooth implant moves more in the breast pocket and may not have that position stability, may move more to the side, may move more to the bottom or bottom in the breast and lose some fullness on the top. We use primarily smooth implants today, and one of the reasons is smooth implants are not associated with ALCL. That is current data that we do not have an association for any noted ALCL cases, this rare type of breast implant associated lymphoma or breast cancer that has been associated uncommonly in 1 in 30,000 cases of implants with textured Sientra implants. Now, breast cancer is thought to be as common as about 1 in 9 women may have breast cancer over their lifetime. So 1 in 30,000 is a low rate. It is important to know if you have a textured implant, either from the past or you get one now, to monitor for swelling, monitor for other symptoms. We'll certainly go through that if you have a textured implant, because it is something that is treatable, particularly if we're following for symptoms. You would never want to place an implant in you that would make you sick. Breast implant illness is where an implant could be making you sick. It's felt to be very rare, and the scientific underpinnings of it are not well understood. That said, I think it is possible in unlikely and rare circumstances that you could have side effects from a breast implant that could cause brain fog or other systemic symptoms. And if were that to be the case, I would certainly say we would want to get the implant out. To my understanding, almost certainly, were that to be the case, if we take the implant out, I would expect a reversal of the symptoms, but I don't have a way of even guaranteeing that. I will tell you, I know personal friends and even family members that have had autoimmune disease where we've had a discussion. Should we place a silicone implant? And I've said, I don't expect you to have problems with it, but I would make you aware that should you have problems, I would certainly want to get the implant out. We've used implants in that circumstance, as with many, many patients, and I've had a very low rate. In fact, I can only count 2 patients of the thousands of patients I've seen over well more than a decade and a half that have convincingly had an issue with an implant that has potentially made them sick, where we remove the implant and they've become well. So it's something you should be aware of, that there's not perfect science on, there's significant disagreement on, that I feel very comfortable using breast implants with, but I would always want you to know that we don't have all information, and I certainly don't want an implant to cause illness or to make you sick. Back to breast implant specific risks on our checklist. So implants are not a lifetime device. We've repeated that many times. They can rupture over time. Data here includes data on rupture from reconstructive surgery as well as aesthetic surgery. So the numbers will be biased high because of that combination. And I don't know what combination of cases this data was taken from. If an implant ruptures, it's got that gooey gel inside, not the old liquid gel from the original silicone implants. If that gel gets outside of the shell, which it will, if the implant ruptures over time, it's got the capsule around it. If that implant gets outside the capsule, it can migrate into the body where it's causing problems, damaging breast tissue, potentially it could even go farther to lymph nodes, etc. When it does that, or if it were to do that, which I absolutely don't expect it to do that, because it's going to cause symptoms. One thing it can do is cause capsular contracture. Another thing is pain, discomfort, a lump, or changes to the breast. So what do? Again, recommended follow-up imaging and follow-up on any symptoms. Those are very important. We don't place the implant and forget it. It's important to monitor for changes in the breast, and it is very important to do the recommended follow-up imaging of the breast. Also recommend you have regular follow-up with me and with your physician while you have the implant in place. We do use the National Implant Registry to follow for outcomes of and give collected national implant data, just to track for research purposes implant data longitudinally. So we have a lot of patient satisfaction and increase in quality of life with breast implants. It's a completely elective procedure. Definitely not for everyone, but it's a super personal choice. One of the biggest implant benefits is that it's the only thing we have that will give us really good long-term fullness that maintains upper pole fullness in the breast versus falling down where oftentimes breast tissue does. For remove an implant though, it's important to understand it leaves emptiness. So now we do have a loss of shape. That can require additional surgery if you want to address it. You can also have just deformity, a loss of fullness or stretched out skin or other changes. So it's always important to recognize that if we're placing an implant as part of our choice for ourselves. Also important to understand that complications are possible, that complications in future surgeries are essentially expected for future surgeries, and that will come at additional expense. I appreciate you following this entire presentation. I feel it's a little dry and stuffy. It's definitely not the way we look at the relationship and partnering with you as patients, but this information is important for you to have. Please come prepared with any questions you have. We look forward to meeting you. I look forward to meeting you. Enjoy your journey, live your journey. That's what we're about. And again, reach out to us if you have additional questions.